Hi, in 5 minutes we're going to show you an interview with someone I was really excited to interview when Paramount Studios called me and asked me if I would interview Dr. Ordon from the show The Doctors, which I stay up at 1:30 in the morning to watch because I miss the 2 o'clock in the afternoon. If I tape it, I'll never see it. But I've learned so much about medicine, so much about therapies, and so much about things that could save people's lives on that show that you really shouldn't miss it. So stay with us because in 5 minutes we're going to be showing you the interview that I did with Dr. Ordon. But we have Nurse Sally and Dr. Tony here again today, and we have a couple of things to show you in the first 5 minutes that I think are really interesting and unique. So Sally, would you like to start?
Sure. This is a medication for severe cold and cough relief, and I understand Karon has taken this. This is for aches, fever, chest congestion, nasal congestion, and it works
fabulously. You know, this company just bought out and changed the name of this. This was originally like Emigrant Forte, and I discovered this when I needed something at Old Chicago, the indoor amusement park for the ride operators. It could be something to help their colds and not make them groggy, and Emigrant in 10 minutes would make you like you didn't have a cold. I mean, it would stop coughing, it would stop draining, and things like that. So this company has bought them out, and this is the closest thing to a natural thing that you can take. It has some things in it that will have a drying effect and stuff like that, but it really helps with those kind of symptoms. You may not be able to purchase this retail, but you can tell your company nurse, an occupational health nurse, to order it. And they should have it really. I always wish they had it on ships. I brought some with me on a ship. I got sick on a ship. They didn't have anything like that. And I thought they really should have it because it really, really made you feel a lot better. And you take it every 4 hours. You can take 1 or you can take 2. And it has, like I said, a few things in it. I've given it to a few doctors who had colds and couldn't get rid of them. And I gave them some of that, and they didn't even know about it. So,
well, this comes from Fort Myers, Florida, and they do have a website. Would you pronounce the name, Karon?
Medique.
Yes, MediqueProducts.com. So if you wanted it, you can go to their website.
I always like to spell it. Is it M-E-D-I-Q?
Yes, it's M-E-D-I-Q-U-E.
Right, Medique.com. So you can have your occupational health nurse ask for it if you can't get it yourself, but it can be, I believe, ordered over the internet. And the other one is?
Medique acetaminophen.
So that's similar to Tylenol. And you were talking
this
about
has no caffeine.
No caffeine in it, which, you know, a lot of Tylenol doesn't either, but they're brand names of different things. And this is for, excuse me, for pain, right?
Same
Yes,
company?
for pain.
Same company.
Similar
And it has
to
a
Tylenol.
little phenylephrine in it too, so that helps the drying effect if you're having problems with your sinuses and things like that. So it's they're good things to have. I've given them as Christmas gifts to people because they liked it when I gave. I was one time with the Emigrant, which this is very similar to, at a wedding, and a woman said, "Oh my God," she said, "my migraine's coming on. I'm going to be sick for 3 days." And I gave her one because they're over the counter. Anybody could buy them. And she took it, and her migraine went away. So can we do the other ones really quickly?
This is a relief band. This is something you would wear under your wrist. It says it's worn underside of the wrist. Gentle electric impulses balance the signals causing nausea and vomiting associated with morning sickness, boating, gaming, airplane, trains.
Can I hold that up?
Mm-hmm.
I want to make sure, or Sally, one of the two, so they can get a close-up of this. It's called a relief band, right?
Yeah.
So it interferes with the pathway of nausea. It's an electrical pulsing.
Probably related
Stimulant.
to
For car sickness and things like that.
acupuncture. Meridians.
Acupuncture, meridian line.
And you can get this at reliefband.com. Let's see, if you want information, it's 877-735-2263. and it's FDA-cleared digital therapeutic device, the Relief Band. Tony, one last thing?
This is a dietary supplement called
Can I have one of them?
Sucontrol D for blood sugar balancing, and it's a dietary supplement, and it
Healthy
has,
insulin.
yes, balancing your sugar, maintaining healthy blood sugar levels, healthy insulin function, carbohydrate metabolism, vitamin C, E, thiamine, riboflavin, B6, folic acid, B12, biotin, zinc, chromium. So there's a lot of different nice
All
nutrients.
things that would help you, maintenance of a healthy blood sugar, insulin function, and healthy A1C, carbohydrate metabolism. So,
One
and that's
capsule
called
twice daily.
Sucontrol, blood sugar.
And you can get it over the counter.
So have we got everything done now?
We have
Okay, one more thing?
one product. This is another Medique product here, and
May I see that?
yes,
Thank you. And this one is Metalite. And this is also something that can be used as an electrolyte replenisher. You know, I said the only time it's good to drink pop is if you've had vomiting and stuff like that, or, you know,
To settle your
bowel problems,
stomach.
and you have to get salt and sugar into you fast. This has calcium, potassium, magnesium, and all kinds of electrolytes in it. So this is also something that helps people, especially working in hot weather and warehouses and things like that, where they're losing through sweating.
like today.
Like today, like it's 100 degrees. I'm still celebrating the 4th of July, in case you hadn't noticed. Okay, now a really exciting thing. I'm going to be excited to see it too, because I really enjoyed interviewing Dr. Ordon. He was here in Chicago and intends to come back in the next 7 years, and let's go and see what we had to talk about. I know Tony and Sally want to see it too, so we'll run the tape. Hi, and welcome to our show. I'm really excited today because I get to have one of my heroes on. He's from the Doctor's TV show, and if you haven't seen it, you really need to watch it because it is the most interesting and fascinating show on television. And it's Dr. Andrew Ordon. Welcome.
Thanks for having me, Karen. It's a real pleasure. At least I have one fan out there.
have many fans.
Well, I heard from Andrea, our publicist, who set this up, and it's a pleasure to be here with you on your show in Chicago. And I've heard good things about you, and I'm ready to talk medicine, talk whatever you want to talk.
It's funny because you're a handsome celebrity.
Thank
but
you.
That is not the main reason that everybody should know you. It's because of the volunteer work that you do. It's because of the surgery that you do. So let's go into that. And let's start from the beginning. Why did you become a doctor?
Why did I become a doctor? Well, it's because I played doctor as a little kid. You know, I did play doctor with my sister and my friends, but you know, I enjoyed science. I haven't been asked this question since my applying to medical school. Why did you want to be a doctor? But you know, I'm a people person. I liked science. I was stimulated by that from an early age, and I like to help people. And then as I gravitated towards plastic surgery, it was the artist side of me that I like working with my hands. I like seeing immediate results, not delayed gratification. You know, that's different with our areas of medicine that, you know, you may have to try this, you may have to try that, but with plastic surgery, we do an operation and you get to see the outcome pretty quickly.
Yeah. Surgeons, though, are amazing because surgeons do things that other people would never do. I mean, really. And you started out with ENT.
I did.
Right.
You know, and part of that was being at USC that had a real strong exposure and history in ear, nose, and throat, a really strong department. I think that's what led me to ENT first, because I knew I loved the head and neck. I loved ENT, and then as part of ENT, you're trained in facial plastic surgery. I really enjoyed that part of it and said, hey, I want to be limited to head and neck. I want to do all of it. So I went on and did the second residency in plastic and reconstructive surgery. That was 7 years. So it was two of general surgery, 3 of head and neck, ENT, and then 2 of plastic and
So
reconstructive.
you can not only make people beautiful, but you can reconstruct things that have been damaged and traumatized.
And that's a a big part of the training is both plastic and reconstructive. You know, nowadays I'm known as the facelift guy in Beverly Hills, but I still love doing the reconstructive part, and I have to be thankful to the show because it has given me a platform where I get to travel, do reconstructive cases abroad as well as here in our own country for people that need it.
Well, haven't you put together a group of doctors that actually does volunteer work all over the world?
We sure did. In our group in Beverly Hills, we came together and we formed a group called Surgical Friends Foundation, which has done a number of trips, and we also do things domestically for people that otherwise wouldn't have access to reconstructive surgery, particularly breast reconstructions. We do some victims of domestic violence. We've done some facial reconstruction, particularly scars on the face, broken noses, that kind of thing.
And I was talking to you earlier about scars because people are interested in that. People who form keloids, if you do facial surgery, do they ever form keloids?
Well, that's a great question. That the face, because of the thickness and the blood supply, thickness of the skin and a very rich blood supply, the face heals very, very well and is less prone to keloids. So in other words, even in those groups, darker skinned Asians are more likely to form keloids. Even on the eyelids, if you're placing facial scars, keloids are very rare, with the exception being on the earlobes. And you see a lot of those. If somebody gets something as innocuous as an ear piercing and then they grow a huge keloid on the earlobe, and that's a tough problem to deal with.
What about smokers? Will you operate on them?
We will operate on smokers, and that comes up all the time. And why is that an issue? I'm not sure if everybody understands why that smoking does affect your small blood vessels. The nicotine effect constricts your blood vessels so that blood flow is just not as good, and blood flow is so important to good healing. It's very important with facelifts. It's also very important for breast surgery where you're relying on small blood vessels. So we will, but we want people to stop smoking, and that's a real added benefit when I can do plastic surgery for somebody and make them stop smoking. And I see that quite often, that people say, hey, you know what, I want to do this and I want to get a great result, therefore I will quit smoking. This is an added incentive for me to do that.
Now, I have another question for you. If you're doing a facelift on somebody who has dimples, how do you handle that? Do they move the dimples?
It's interesting that dimples are an interaction of the action of the facial muscles with a connection to the skin, to the dermis. That's why when they smile, they get their little Shirley Temple dimple. We don't change the dimples. I occasionally have people who want dimples, both in the chin and yes, but typically with a dimple, it only appears when you smile, so it's a dynamic dimple. If we create one surgically, you're going to have that dimple all the time.
Okay.
So that's a trade-off.
If you're lifting the skin, does it lift the dimples?
Well, we're deep enough where that connection still stays, so we don't lose somebody's dimple.
Okay, the other question is about bags under the eyes. That's supposed to be fat, but if they're sunken in, how can they be fat?
Well, the eyelids have, we do more and more of that. It's become more scientific. We get the aging process around the eyelids, and it's a combination of what you said. It's a loss of volume in the so-called tear trough immediately above the cheekbone, whereas in some people you have the bag formation, which is the fat pockets that we have, the tissue that holds them in loosens up over time, over age, forming bags. But you're right, for some people that it's a combination of the bagging and loss of volume in the tear trough or over the cheekbone that compounds that issue.
So can you still fix that by going inside the eye? Or you
Yes, no, every eyelid case is a little bit different. Sometimes it's just the fat, sometimes it's excess skin, sometimes you also need to do a suspension to support the lower eyelid so that you don't get that, so-called pull down and that exposure of the.
I don't think people often realize how much tension surgeons are under because of the fact that when you go to do any surgery, you don't know what you're going to run into.
Well, everybody is a little bit different, and that's why patient selection is so important, and that's why pre-planning, in my mind, I know what I want to do, and I have a pretty good idea what I'm going to find, what I expect to find. But you're right. Sometimes you're wrong. You never know how tissue is going to respond till you get in there. So that's part of the excitement of being a surgeon. Yes, you never know exactly what you're going to get. But getting back to the pressure, yeah, that with elective aesthetic or cosmetic surgery, we can't have bad days. That we're expected to get great results, consistent results every time. So, baseball, you hit 1 out of 3 and you get into the Hall of Fame. It doesn't work like that.
Well, people ask me about whether I'd rather be in the emergency room or be on television. And I have to say, what you're doing on television is wonderful because you're reaching outside your office into you have a hospital without walls. Mm-hmm. But at the same time, there's no reward like doing what you do in surgery.
Yeah, I still consider myself a doctor or a surgeon first. I've been doing that longer. I've been doing that over 30 years, whereas television about 10 years. But I am getting better at television, though. I think I've found a little bit of a groove and am more comfortable doing it.
Well, I think everybody should watch you.
Well, thank you.
All of you, but you definitely come up with the greatest personality.
Well, thank you. I appreciate that, and I have fun doing it.
You've been to Iceland.
That was my most recent trip.
Your cryotherapy? You jumped in the ice water.
I jumped in the ice water, and I also jumped in the geothermic pools in Iceland that we don't realize that Iceland is a volcanic island, and they have all of these volcanic activity in the earth that's heating the water. They have all these natural springs of hot. Oh, fantastic! So I went to the world famous Blue Lagoon, where people come from all over the world for the therapeutic effect of the waters. It's a combination of the heat, the minerals. There's a real specific mineral content as well as algae content that is good for all ailments, but specifically skin ailments. People come from all over the world for their eczema, for their psoriasis, for...
Really?
Yes.
But you've also been in hot saunas too. I've seen you in.
Well, I'm a believer in in saunas, in steam, and you saw me do the cryotherapy there in Hollywood, where you get into that freezing.
Did that feel the same as in Iceland, or no? It's different.
No, because that was a controlled. That's like stepping into a freezer. There, you're going in and out from the hot waters, and then the ambient temperature is cold and windy.
Where are they going to send you next? What can we look for?
Well, I had so much fun doing this, and it was pretty well received. So we may do more of those where they send me somewhere, and I like doing that, exploring medical mysteries and myths. Almost like Anthony Bourdain traveling around the world, but looking at things instead of from a culinary perspective, from a medical perspective.
But what is your favorite surgery to do? I know you've done a lot of things with that smile trade or something.
Yes, well, I enjoy doing cleft lips and palates, but probably what I like doing the most is nasal surgery. I think most plastic surgeons agree that it's the most challenging.
Are you talking about internal or external?
Well, both. Because of my ear, nose, and throat background and being a plastic surgeon, it's the combination of making somebody be able to breathe better, function better, as well as the appearance part. And I think we plastic surgeons agree that it's probably the trickiest procedure that we do. Every nose is different. It's a hard procedure to learn, to teach, because it's a very small contained space. Now we do what's called open nasal surgery or open rhinoplasty by making a little incision here, and inside you can actually lift all the skin up and see what you're doing. But when we trained in the old days, it was closed, that it was only one person can see what they're doing because of the incisions and the headlight and the instrumentation. So it was hard.
And you're
It
dealing
was
with
hard to
sinuses
teach.
and the brain.
Well, all of that. It's
Yeah.
all very close. That's why you got
Be
to.
so careful.
Yes, it's very delicate real estate there, for sure.
But you're not afraid of any of those things.
Well,
I mean, you've done a lot of training.
I'm aware of it, yes, and experience, and having done many, but you're always staying
Where's
focused
your
here.
office in Los Angeles?
In Beverly Hills, on Roxbury and Little Santa Monica. So in what they call the Golden Triangle of Beverly Hills.
You've got many other plastic surgeons to help out on the show, too. I mean, they've done a tremendous amount of things in other cities that you can't
We
get.
do, and you know, our show is story driven. So if we find really compelling, great guests that have a story, whether it be trauma, whether it be massive weight loss, and they have loose skin that they want addressed, you know, I try to do some of them. I can't do all of them, but there's something to be said for having your surgeon, you know, right there in your community, so he's available for follow-ups. It just makes it that much better. So yes, we find appropriate guest patients, and then we reach out to qualified plastic surgeons in their communities, and it's worked very well.
Dentists.
And dentists, oh yeah, the makeovers, yes.
You know, and there's things on there, like I said, it should be required for the public, but especially for doctors and nurses to watch your show, because I always wait to see what the newest thing is that has been found by you. And if there's things that save people's lives that not everybody knows.
Well, that our producers really are looking at the newest, latest, greatest of what's going on in medicine. I mean, certain things don't change, but medicine, as you know, is constantly changing and new and better ways to address things. So
I mean, some
that's
of
what
the
we try to.
techniques that you have found that people are doing.
Oh, yeah.
Have saved people's lives. I mean, brain tumors and all kinds of things.
For sure, the cutting edge technology, and you know, you brought up brain tumors. That's why I'm here in Chicago. I'm dropping my son Matt off at Northwestern. He's starting his residency in neurosurgery at a great world-class institution. I'm so impressed with that spot. That whole Northwestern Memorial Hospital campus is really world-class, and what a great place to train, to be able to live in a great area and train at a great
And you
institution.
can find out about Winters.
Well, he went undergrad to Colgate, which was upstate New York, which
Oh,
was
okay,
cold.
so
So
he's
he
already-
knows a little bit about that lake effect and cold winds coming off the Great Lakes, and you know, he says I can handle the cold, so we'll see. But
Well,
right
our
now,
winter wasn't bad this last year, so maybe
okay,
we'll be
so
lucky.
so
We
knock
only had
on
like
wood.
3
I mean,
snows.
it is gorgeous here now. I'm enjoying. I always enjoy Chicago.
Well, I hope
Great.
you'll come here more.
Well, I will be. I will be, and whenever I come, I would love to do
That's right.
TV
And next
with
time we can
you.
do it in the studio.
I will do that.
We'll have you
I will
show
do
all
that.
kinds of things.
Okay.
We'd even like to have your wife on or something, and your son.
That would be
your dog.
fun.
We'll
That
have a
would be
family
fun if we can get them all. That could be fun. Watch the interaction. You know, your background as a psychiatric nurse, you may make a recommendation or two when you see the family dynamics going on there.
And of course, you know, we worked in surgery when I was in school for 3 months, and I know what a stressful thing it is. So I know the pressure. I mean, I wasn't the surgeon, the pressure was different on us, but surgeons do have a lot of pressure. And sometimes people say, well, they have bad personalities, but it's the stress they're under, and actually, some don't even exhibit that, you know.
I mean, surgeons do have that certain type of personality, and part of it is, like you said, just being focused, and you want your surgeon to be very meticulous and orderly and neat and focused, but there's a happy medium where you still have to have that bedside manner too.
You get called to the emergency room a lot too for trauma type things, or not?
Not really that much anymore. When I was younger, I took call more. I only have X amount of time these days. Yes.
Well, yeah, if you're taping shows on top of it and running all over the world and volunteering your time, when do you sleep? They ask me, it's you that they should.
Well, my plate is full, but I love it. That's the way I thrive. I don't think I would want it any other way.
Well, people should definitely watch The Doctors, and here in Chicago, it's on at 2 o'clock in the afternoon for those of you who have children, and they say sometimes that the children shouldn't see certain things that are on there, but there's never anything out of place. It might just be because of the trauma or the surgery or something that they're showing, but from 2 to 3 in the afternoon, and also at 1:30 in the morning you can watch it, from 1:30 to 2:30, if you don't want to be disturbed, like I don't want to be disturbed when I watch it. Because you can learn so much, but you know, rather than watch any of the other stuff that's on, I mean really, rather than watch soap operas,
reality
TV, people can learn, and they can save their own lives and their kids' lives by watching
They really can, and that's what makes us feel so good about our show when we have stories, when people come on and say, hey, because of you talking and demonstrating CPR, I saved a life, or I got somebody to quit smoking, or I got somebody to get their type 2 diabetes under control and lose weight as a result of our show. Those kind of stories do make us feel really good.
Too is it's not one doctor on, it's 4 of you, so you all come from a different, like a case study type.
Exactly, different specialties and different perspectives, and then we have to meet and chime in on all topics, so it keeps me on my toes.
What would you do if you weren't a surgeon?
Well, I could see myself practicing ear, nose, and throat that is a surgical specialty too, but I could have done that as, a general ENT doing nuts and bolts ENT. I do, yes. I teach at USC School of Medicine. I'm a co-director of the Aesthetic Fellowship. So plastic surgeons that have completed training who want additional training in cosmetic aesthetic surgery, they come spend a year with us. So there's a group of 4 of us who run this fellowship. So I'm still active in teaching and I learn from the young doctors. It keeps me on my toes. I love it.
Somebody told me they don't have to take call anymore. Is that true?
It's changed, for example, for my son, starting at Northwestern, there are restrictions about how many hours in the hospital and how long you can stay in the hospital at a given time, and how much responsibility you can be be right off the bat.
Never used to be.
No, none of when I was coming through. Oh yeah, the hours that we put in, those things didn't exist, and they changed it. And I think that you will see enough and do enough and stay busy enough that it's probably a good thing, a change that it's more likely that things could fall through the cracks if somebody is tired, who's been up all night, multiple days, things like that. So I think those changes, monitoring that is a good change.
Well, you came through it. We've only got 3 minutes left.
Okay.
I want to give those 3 minutes to you.
Okay.
In case you don't know who you're looking at, is Dr. Andrew Ordon. You see him all the time on The Doctors, and he's quite a personality and quite a surgeon. So what would you like to say?
Well, I'm just delighted to be here in Chicago, and I want to thank you for inviting me as your guest.
Thank you.
Can we plan that this is the first of
Many.
a series
Whatever
of
you wanna talk
you're a lot of
about.
fun, you're great. I want to give a shout out to Chicago. I was born here. My parents are, I'm a Polish American. Both of my mom and dad were Polish American, came during the war to Chicago and met, and the city is very close to my heart.
How long did you live here? Did you live
Just for a few years, and then moved to California. But the people are great. My son's going to be here now for 7 years training, and I want to give a shout out to Northwestern. What a great institution, and
I dealt with
to the
for many
city.
years. I owned a healthcare agency, and we did both staffing and home care for the patients that went home. Northwestern is great. The professors are great. Their doctors are great. Everything is great. Yeah.
So that's it. Keep on watching The Doctor. Season 9 will be starting in the fall, and
Look right at the camera, though, to make sure that they get to see what the best-looking plastic surgeon is.
your teeth do kind. At least I know I have one
And you haven't
fan.
had any plastic surgery, I'm sure.
No,
right?
look, no incision
No incision.
yet.
But anyway, I can only say that watching The Doctors is the most interesting thing and the most beneficial thing that you can possibly do for yourself and your family. Whether you're a medical person or you're a layman, you've got to watch The Doctors. And thank you for joining us on Outspoken with Dr. Andrew Ordon. Watch The Doctors TV. Thanks. Bye.
Thanks, Karen.